My name is Dr. Marie Navar, and I'm one of the preventive cardiologists at UT Southwestern. Today, I want to talk about a risk factor for heart disease you may never have heard of, called lipoprotein A, or Lp(a). What is Lpa? To understand Lpa, I first have to explain cholesterol particles. Cholesterol isn't dissolved in our blood. Rather, it floats around in little packages that we call lipoproteins. These packages have cholesterol and triglycerides in them. Now, LDL particles and VLDL particles are usually the ones we think about when we talk about bad cholesterol, because these are the particles that can get trapped in the artery walls, cause plaque buildup, and if not treated, they can lead to heart attacks and strokes. Lpa particles are another type of cholesterol package. These particles look just like an LDL cholesterol particle, but they have an extra protein attached to the outside of them. That protein is called ApoA. Combined, this particle forms an Lpa or lipoprotein A particle. The ApoA protein on this particle supercharges it and makes it more likely to get trapped in the artery wall and cause heart disease. It also makes the trapped cholesterol more likely to break off and cause heart attacks and strokes. What causes high Lpa levels? Well, it was actually researchers at UT Southwestern who discovered that your Lpa level is determined almost entirely by your genes. Each of us gets one Lpa gene from each biological parent. If one parent has a high Lpa, the chance that their child has a high Lpa is about 50-50. So if your Lpa is high, there's a 50% chance that your children or your siblings also have a high Lpa. Because of this, we recommend that all people with high Lpa tell their family members about it so that they can get tested too. Unlike LDL cholesterol, diet and exercise don't affect Lpa levels. Also, Lpa levels are very stable over our lifetime. We actually reach our adult Lpa levels by our early teenage years. That means that if your Lpa is high, it's been that way since you were in middle school. And because Lpa goes up early in life, it's a leading cause of early or premature heart attacks and strokes. Many people with high Lpa have multiple family members with heart attacks or strokes in their 40s or 50s. Women do experience a small increase in lipoprotein A after menopause, but this is probably not enough of an increase to make a meaningful difference in risk. What counts as high for lipoprotein A? Lpa can be measured in two different ways, by weight or by count. At UT Southwestern, we use the count method because it's more accurate. This test gives us a result in nanomoles per liter. We think that risk starts to go up around 50 nanomoles per liter and then rises with increasing Lpa levels. So if your levels are closer to 50, you're at increased risk, but only just slightly. We consider somebody at high risk from Lpa when their levels are at or above 125 nanomoles, which is about the top 20% of the population. From there, risk goes up as Lpa goes up. So at around 200 nanomoles, your risk for heart disease is about doubled compared to somebody with a normal Lpa level, and by 400, your risk is increased by about fourfold. I'll also point out that most people actually have Lpa levels well below 50 and many under 10. Why have I never heard of Lpa before? Doctors have known about Lpa for a long time, but there haven't been any medications to treat it. So unlike LDL cholesterol, which is checked regularly, there weren't guidelines that recommended that we test lipoprotein A, but that's changing. New medications are being tested in large studies to see if they can lower Lpa and prevent heart attacks and strokes. Our team at UT Southwestern is part of some of these studies, and many of our patients have already joined us to help us learn more. If these medications are effective, we'll want to know who has high Lpa so that we can treat them. That's why at UT Southwestern, we've started testing for lipoprotein A far more often. We also test it so that we can better manage other risk factors when lipoprotein A is high. What can I do while waiting for medications to lower lipoprotein A? Even though we can't lower Lpa yet with medication, we can lower your overall risk for heart disease. A heart-healthy diet and regular exercise are incredibly important for heart health. Other steps include keeping your blood pressure and blood sugar under control, avoiding smoking, and lowering your LDL cholesterol levels. Now, we can't lower LPA itself, but we can lower LDL cholesterol, and we think by lowering LDL cholesterol, we're helping balance out some of the risk of high LPA. This often means using statins or sometimes other medications to lower LDL cholesterol. If your lipoprotein A is high, your doctor may aim for a lower LDL cholesterol goal. Where can I learn more about lipoprotein A? The Family Heart Foundation has a great website with information about lipoprotein A and other information about inherited cholesterol disorders. Other great resources on heart health can be found on the American Heart Association's website at heart.org.